Hypertension, also known as high blood pressure, is a common disease among people who are older than 50 years old. It is not rare for people to be diagnosed under 50 years old, but the older someone is, the more frequent it is to be present. There are two forms of hypertension. The first and usual one that occurs to people is called primary hypertension, and 90% of people normally attain this disease. The other hypertension is called second hypertension. Only about 10% of people get that form of disease. Now, primary hypertension is also referred as the silent killer, since symptoms do not show up unless people check their blood pressure. There are several ways people may acquire the disease, and one way is by heredity. If a parent has the disease, it is twice as likely that the child is going to end up with the disease. Also, African Americans than white Americans are more susceptible to hypertension. If people consume large amounts of salt, saturated fats, it can contribute to hypertension and can transverse to obesity and diabetes mellitus if adequate measures are not taken. As I mentioned before, age is a factor as well, and it is more common for people over 40 to acquire the disease. Fourthly, people who smoke increase the chance for nicotine to disturb the sympathetic nervous system, which can cause vasoconstrictor effects. Finally, and lastly, stress is critical for the contribution to hypertension. People spending too much time stressing can trigger hot reactors, which leads to serious high blood pressure. Heredity, diet, obesity, age, diabetes mellitus, stress, and smoking are symptoms and risks associated with hypertension. A normal person should have a blood pressure of less than 100 milliliters per mercury systolic and less than 80 milliliters per mercury diastolic. A person who reads a level higher than 100 milliliters per mercury and higher than 90 milliliters per mercury is known to have high blood pressure, and if it keeps persisting, it can damage the brain, heart, kidneys, and retinas of the eyes. Hypertension till this day has no cure, and it is important for people who are diagnosed with hypertension to always be checking their blood pressure. There are many different methods for people to reduce or prevent hypertension. One way is by managing a stable weight. Being overweight can increase the chance of getting hypertension. Another way to prevent hypertension is by getting daily exercise. Getting 30 to 45 minutes of walking a day reduces the chance of getting hypertension by 20% to 50%. Thirdly, it is better for people not to eat extra salt on their food. Mostly all the food that is consumed has large quantities of salt. Also, it will be ideal for people to stay abstinent from smoking and drinking alcohol. But drinking 1 or 2 alcoholic beverages for men and 1 for women a day is fine. Finally, it is crucial for people to stay stress-free. Stressing increases the chance of high blood pressure. There are several ways to reducing stress, and some examples are doing yoga, reading a book, listening to music, and anything else that is relaxing to you. Also, consuming proper amount of potassium, calcium, magnesium, fish oils, and garlic can prevent a free lifestyle of hypertension. Overall, it is crucial to follow the guidelines of staying hypertension free.